Welcome to STEM Spark, a podcast dedicated to helping teenagers explore different careers in STEM. My name is Mira and I'm your host. As a high schooler myself, who is currently struggling with determining my future career path, I created this podcast to hopefully explore some different career options myself, while also helping others do the same. I hope you guys are excited for today's episode because I am. Today we are here with Dr. Ragan, who works in clinical psychology at Mass General Hospital. I'll now turn it over to Dr. Ragan to introduce herself further.
Hi, Mira. Thanks for having me on today. I'm really excited to talk about my career and hopefully inspire some people to go into this line of work because I love it. I love what I do. I'm very passionate about it. It's been a very rewarding career. So hoping other people are inspired by what I talk about today. So again, like you said, I work at Mass General Hospital. I'm a clinical psychologist. I also have a private practice, which is really nice to have a balance between the two. So I'm a clinical psychologist, which means I got my PhD. So sometimes people wonder, if I do medication, do I do therapy? So I didn't go to medical school, and so I don't do medications, but I do a lot of the therapy. Mm-hmm. I also am involved in some research at Mass General Hospital, which is really nice. I supervise other therapists who are in training. And another thing that I'm doing is getting involved in developing new apps like digital therapy to help people just to give access to more people across the country, across the world who don't have access to therapists because there's a real lack of resources for people. So that's another thing I'm also working on.
That's amazing.
Yeah,
Wow.
yeah, fun.
Okay, so I want to start with just kind of how you got into your career and what made you interested with it initially. So, going back to college and your school, did you know that you wanted to pursue this in college? What did you major in? How was that experience for you?
Yeah, so growing up, I'd say that, I was always the kid who was kind of, if my friends were having conflicts, I was always trying to bridge the gaps and help people make up. But I didn't think I was going to do a career in it. I don't think I even knew about people like psychologists. I don't think that was on my radar. So I loved school. I loved math. I loved science, especially chemistry. I loved computers. I loved programming. That was the kid I was. I did math tutoring. I was on the math team. I really thought I was going to end up in a career like that. But then so I was geared up and I was already applying to schools where computer science was really the focus. So then my senior year of high school, I took an AP English class and we were reading, things like The Bell Jar and Macbeth and just these, talking about some very complicated characters and talking about mental health. Mm-hmm. And I found myself being very drawn to trying to, analyze those characters. So before, I'm very analytical, and I used to do that in math and computer science. But now I was finding myself drawn towards trying to understand and analyze people. So then I decided to take a psychology class and totally change what I wanted to do. So I applied to schools that were good in both computer science and psychology because I really wasn't sure which way I was going to go. But I wanted the option to do either one once I got to school. So I ended up going to Carnegie Mellon University, which again, very well known for computer science and robotics, but also had a really good psychology program. And once I got to college, I kind of knew that's what I wanted to do. It was by the end of senior year, I was kind of I think I want to do psychology. And in the process of that, so I was valedictorian of my high school, very good student. My teachers were very disappointed, I think, that I ended up doing psychology. I think they really, my physics teacher wanted me to do physics. My computer science teacher wanted me to do computer science.
Naturally.
And when I gave them the news, there were a lot of sad faces. But what I will say is I am so glad I was okay with disappointing them because I love what I do. And so I also give people advice, just, do not be deterred by, what you think other people expect you to do, because ultimately it is your life. You're going to be the one spending day in and day out doing this career, and you want to do it for yourself and not for what other people expect you to do or want you to do. Um, I went to Carnegie Mellon, excellent school, and I just went straight for psychology. I knew I was going to, for psychology, you really need to go beyond college. You can't just start or stop there. You have to do a master's or a PhD or a PsyD. And so I took all the required classes and I got involved in research. So that's another thing I would advise people to do if they ever want to do this kind of career is I got involved my junior year doing research with a professor there, and kind of was like, was acted as a grad student actually with him and did a lot of my own research and honors thesis. Because in order to get into a PhD program, you kind of have to have research, have done research and published and written. So I really prepared myself by doing that in college.
Awesome. Yeah.
Yeah.
What you were saying about the science and math, it's kind of fun. It's funny that your teachers and everything, but that's
Yeah. Yeah.
I can see.
Yes, yes. They didn't love that, but yeah. Mm.
So yeah, so then you said that you pursued a PhD, a master's degree afterwards. So, um,
Yes.
how was that for you? And what did that look like?
Yeah. So now, I applied for a PhD right out of undergrad. A lot of people don't do that. Some people, what they'll do is go and work in a research lab for a couple of years and get more research experience. I was open to doing that. I did apply to some jobs doing that, but I also applied to PhD programs because I was pretty certain that's what I wanted to do. And again, I already had research experience. Some people in undergrad don't get that experience. So then afterwards, they have to go and get it in a research lab.
Right.
So I had already had it. I think I applied, how many schools? Oof. I probably applied to like 15 PhD programs. Well, I applied to a lot because I was applying to like all the top schools. I basically looked at like what are the top, 25 PhD programs in clinical psych, which are the ones that I could live in the city where they are, and then I applied to those. So I knew it was going to be competitive because I was applying to really good schools. So I applied to a lot and ended up getting into a few and getting interviews at several, and settled with the University of Texas at Austin. Loved it. Excellent school. Loved Austin, Texas. It was a great experience, and I was in a research lab, and in my PhD, also a piece of advice I would give to people is try out different things. I tried cognitive behavioral therapy for anxiety disorders. I tried group therapy. I did families. I did couples, groups. I did. I work with people with eating disorders. So I really tried a lot of different things
Mhm.
because for me, I wasn't sure exactly what I wanted to do yet. And so I tell people, just try it. Like really, this is your time to try it out so that you know what you want to do. Like sometimes you can't figure it out by just thinking about it. You have to just try it.
That-
So that was really useful to do that. And I found that I loved people working with people with anxiety disorders, OCD, spectrum disorders. And so that's how I discovered kind of like what I wanted to do later. And then you have to do an internship. So just like, doctors, have to do a residency as part of it after their MD. I had to do an internship at the end. I applied kind of on the East Coast because I'm from the East Coast, and applied to Mass General Hospital because they're also, like, again, an excellent program, excellent hospital, and got in there. And I've been here ever since. So it's been, 20 years. It'll be 20 years this July. So,
Wow.
um,
Congratulations on that.
yeah, it's great. It's a great place, great people to work with. So, and I think that when you set yourself up to really good programs, and you think ahead, it just like it gives you these options to work in the places you want to work and to work with really excellent people, and it's a very satisfying place to.
Um, you mentioned that you've been working at Mass General Hospital ever since then. How is like has has your job or role changed since when you first started working there to what you're doing now at the
Mm-hmm.
hospital? And
Mm-hmm.
how has that been?
Yeah. So well, yeah, and another piece of advice I would give people is when I was on internship, you also do a postdoc, so you have to do both.
Okay.
So
Okay.
I, I was trying to, because I wanted to stay at Mass General, and I knew that I really liked like OCD and related disorders and anxiety disorders. I got involved in research with a researcher, so Dr. Sabina Wilhelm at Mass General, who was doing research in that area, and got trained under her. And so doing things like that, it kind of sets you up for people to already know you. So I was like a known quantity. I had already been trained by her. And so after I finished my postdoc, she hired me on as a staff person. So when I first started my job, I was half research and half clinical. So I was working on a study looking at like the genetic factors behind OCD, and like it was a more longitudinal study. We were like following kids who developed OCD early in their life, like over time, trying to determine like why these kids, like and comparing them to controls, like what's different about people with OCD versus people who don't. And then I moved into, once we weren't doing that, moved into like a therapist role on studies. But slowly I increased my clinical just because I really love the clinical. Research is great, and I like being involved with it in a smaller way, but it's you don't get the immediate gratification with research, right? Research is like the long game. You are
Mhm.
putting in the time, and it can take years to do a study and then to publish it and have like your research out there. With clinical work is there's that kind of immediate gratification of I helped somebody today. So I found that I really enjoyed that work like more, and so I started doing more of my time clinically, and again, still keeping a foot in research.
Mhm.
But the clinical part was something that I really enjoyed. So I just slowly increased that clinical part and reduced the research. And over time, also, like I was initially full time at Mass General. A lot of people do go part time because they do develop their own practices on the side, partially because it just gives you more freedom. It's also like more income. It's just like, when you do private practice, you can make better money than at the hospitals. So I did that. So that changed over time, where I was 100% at Mass General, and now I'm like 50%. So like kind of that went down over time. And I also became a supervisor at Mass General. So I started taking on residents and interns who were new and training them also. So kind of like doing teaching as well.
That's
Yeah,
amazing.
it's really
It's
fun. It's really
it's
fun.
so cool.
Yeah, it's great.
I personally like I've never I don't know. I've always been interested in like psychology, just kind of like what
Mm-hmm.
it is and things like that. So this is like really interesting for me because I'm getting to learn a
Mm-hmm.
lot about what your
Yeah,
life is.
it's really fun. Yeah.
Yeah, it seems amazing.
Mm-hmm.
Um, so you mentioned a few times your private practice.
Mm-hmm.
How is that like different from working in a hospital, and what do you do there,
Mm-hmm.
daily, I guess?
So it's not hugely different. I mean, I'm seeing patients both places. Privately, you kind of like set your own rates, and like I don't take insurance privately, whereas at the hospital I take insurance. So those are the differences. And privately, I can see people for longer at the I can see them for years if I want to. In the hospital, we have so many people to serve that we have time limits on how long we can see people. And my patients at Mass General are more severe, so I'm getting people who are usually maybe on disability, not working, maybe a lot of people who haven't managed to get married, have a family, because it's just like too difficult given their diagnosis. Some people are like somewhat housebound, like it's hard for them to get out of the house. So I'm just get more suicidal. People are just more severe. So
Mhm.
that tends to be more of my population at Mass General. And privately, people are a little bit more high functioning. Again, they have like jobs, they have like relationships, families. So they're still struggling, but they're a little bit higher functioning. Um, And the fun thing about my job, so again, I do cognitive behavioral therapy. I do like a mixture. I also do a little dialectical behavior therapy. I do mindfulness and meditation, but more so I'm skills based. So the other main type of therapy is psychodynamic, which is more looking at how your experiences growing up might have contributed to how you are today, or that's part of it. And these are very simplified, like how, definitions of these. But
Of course.
I tend to come from more of a skills based approach. We do see a lot of people, even as children, where just all of a sudden, age 5, they are, they have great parents, they're living a great life, no traumatic experiences, and all of a sudden, boom, they develop, OCD, or, during adolescence, they develop, some sort of anxiety disorder. I'm trying to help those people who are struggling manage it and help their families also help them manage it. And so I do a lot of skills work. And what's kind of fun is that sometimes I will go outside the office to do things. So again, like I work with people who have OCD, obsessive compulsive disorder. They can show up in a lot of different ways. It can show up as it's called the doubting disease. So people can doubt anything. It really tortures them. People can think, what if I secretly want to run myself off the road when I'm driving down the street? What if I want to stab somebody I love? I mean, again, all these like aggressive thoughts, sexual thoughts, all these like really strange thoughts that come into their mind. And they're like, what is that? That doesn't feel like me. But my brain keeps bringing it to my attention and keeps making me think that I secretly want to do that, or I'm going to do that. Or so again, people get really hung up on that. And so part of doing CBT is, and they get scared of things. So they start avoiding things that bring on these thoughts. So, an easy example for the germs, the contamination thing would be, I have a lot of patients who open doorknobs with like with their sleeve, or they're Purelling all day, things like that. So I'm trying to help people, act in a way that is like kind of more the norm, where people are able to confront these situations without doing lots of rituals and compulsions. And sometimes with OCD, you're also just trying to confront the thoughts instead of running away from them. So sometimes I'm doing work outside the office too. So I'm not, a lot of times I'm in the office with people, or I'm virtual now too. But a lot of times I'm also going outside the office with people to be like, let's go touch some stuff that you've been avoiding touching, and just like get used to it. Or okay, like let's, and now that it's virtual, I can be like, okay, go over to your stove. I want you to turn it on and cook something, and then you're going to walk away from it without doing, without checking a million things, or asking somebody else to turn it off for you. And we're just going to tolerate the anxiety of doing that. So I do a lot of, I think it's really fun. It's I'm making people do things they're afraid to do,
Mhm.
but a lot of people get better from doing it. And that's an also very rewarding part of my job, is
That's
seeing
amazing.
people succeed and get better, and all of a sudden they're like, I have my life back. Because again, people get trapped by these fears, and it takes over their life. And it's so, I have so many people who are like, oh my gosh, I have my life back now. And they're really thankful. And I love seeing that happen. So that's kind of, I get to do those fun things too.
That's so cool. That's
Yeah, it's
so
fun.
cool. Just to backtrack a little bit, do you mind explaining like what cognitive behavioral therapy is? CBT.
Yeah. So, so it's you're looking at the cognitions and the behaviors that people engage in. So, and again, like you're trying to analyze what are, what are the thoughts that people are having that drive their emotions, and then what are the behaviors they're engaging in as a way to cope with those feelings that actually make things worse. So it's like there's this in CBT we have like the triangle, where you're like thoughts, feelings, and behaviors kind of all interact, and they um it's multi-directional. It's not just one direction. But so let's say, you, I'll use an OCD example because I'm doing that a lot. So a lot of people will think, let's say you leave the house and you say, you have the thought, did I lock the door when I left? Like, did I turn off the stove? this morning? I can't quite remember if I did for sure, because again, usually we do things like that automatically, right? People aren't like specifically like, okay, I'm turning off the stove now. They just do it and don't think about it. The average person, when they have that thought, is like, I'm not sure, but I probably did. I probably did. I don't remember for sure, but like usually I do. It's probably fine. And they can walk away from it. My OCD patients, when they have any sort of doubt about something, doubt equals something bad. So again, like, the average person is like, I'm not sure, I'm not positive, but it's probably fine. They fill in the blank with, it's probably okay. My OC patients are like, I'm not sure that I did it. Therefore, it means I probably didn't. Like any doubt, any uncertainty means that something really bad is going to happen or has happened. And so they're really afraid of that. So like that's an example of like a cognition that some of my OCD patients have. Then because if you're thinking, wow, I'm not sure if I turned off the stove, therefore it's probably on at home and it's probably burning down my house, that's going to cause a lot of anxiety. Whereas the average person is like walking away being whatever, it's fine, right? They're not having that anxiety. But my
Right.
patients are like, they're like envisioning their house burning down in their mind. And so they're freaking out and feeling really anxious. And so, but again, they then respond to that. So then the behavior is, well, if it's really possible my house is burning down, I need to call somebody to go check it. I need to drive back and check it. I need to start taking pictures of the stove, when I turn it off. I need to check it like 10, 20, 30 times before I leave, like, because I can't trust myself. I am not someone who knows how to do basic things. And that behavior in the moment, like, let's say they're like, hey, they call somebody and they say, can you go check to make sure that I'm not burning down my house? In that moment, they feel that short term relief of, they alleviate that anxiety and they feel better. However, in the long run, again, what happens in that triangle is it reinforces the thoughts because it's like giving into a bully. It's like you have just given into the bully. You have just said, wow, I believed that thought enough that I acted on it. I actually did something about it. And so now, even though I feel better in this moment that, okay, no, the house hasn't burned down, in the long run, I've just reinforced this idea that I can't trust myself, that when I feel any sort of doubt, I have to respond to it like it's a real threat. And when people do that, they tend to do more and more of these compulsions and behaviors, and it just gets them caught in this web, in this trap. And then also we're trying to figure out what behaviors are you doing that are kind of actually making this worse for you. And we have to attack both ends.
Cool.
Okay.
Yeah. That I never thought about that, like the triangle thing, like you said. That makes sense.
Mm-hmm.
I think a lot of
Mm-hmm.
the things you'd mentioned before also like lead into each other. So that's awesome.
Mm-hmm. Mm-hmm.
So I also heard you mention a few times the thing you're doing with like digital and something with an app or something like that.
Mm-hmm.
Can you explain what that's like, and what your
Yeah.
experience with that has been?
Yeah. So it's called Dr. Katz. It's Katz. And it got started by Nathaniel Hunt. He's out in San Fran. And I think he started probably like 3 or 4 years ago. And the idea behind it, so there have been a lot of mental health apps over the years. I mean, I probably started at least 20 years ago, so this is not something new. But
Wow.
what they found was that a lot of times people might start the app, but they don't continue with it. And we were trying to figure out, it's like figuring out why.
Mm,
Why are people not using them? And a lot of times it was because there wasn't a human involved in it. So there wasn't like a clinician involved. And so people would drop off after like a few like sessions or experiences. They just wouldn't use it. So I think now the idea is to do apps that are in conjunction with your treatment with a treater. And now, again, that doesn't necessarily solve the access problem where people need to see therapy, to see
right.
therapists. But the way that we're hoping it might is that if you have, so again, right now, I've myself and several other clinicians at Mass General and at other like locations,
Mhm.
across the country. So again, other people are participating in this, are trying to make psychoeducational videos. So like videos about, educating people about disorders, because a lot of times that's what you're doing in therapy. And then we're also trying to do, so, like I don't know if you do any workout videos ever. Like there are tons of workout videos on the web, right? And so I thought, like, why don't we do some videos for therapy that are like similar to workout videos where you
Yeah,
could
totally.
like be like, okay, this is how you do this certain skill, and you could
Mhm.
do it along with someone in a video, or kind of like cooking videos, right? There's so many cooking videos out there where someone is like, okay, yeah, you could just look up the recipe, but I'm actually going to do the
Do it.
recipe, see it, you're going to see it, it's going to be easier. I'm going to give you little hacks to do along the way. People love that. People love
Right.
watching that, and then they want to go do it. So I thought, like, why don't we do some videos showing people how to do the therapy, and then they can kind of also follow along. And the idea is that in between sessions too, if people are like, oh wait, what was I supposed to do? They can go back and look at the videos for support instead of having to talk to their therapist. So we're trying to develop those videos, but the idea is to give people, better care and also give more people access to care. So it's really fun though. It's really fun like making these videos, and because again, that's like what people love right now. Like,
For sure. For
TikTok
sure.
and
Of course.
Instagram and YouTube. It's just like people want to see people doing these
Mhm.
things. So yeah.
Mhm. Yeah. No, that makes so much sense. That's so
Yeah.
cool.
Mhm.
Um, okay, so you've explained kind of what each of your roles looks like and like what you're doing. How do you like manage doing all these different things, and what does like a typical day or week look like for you with all these different positions and
Mhm.
things that you're doing?
Yeah. So I'd say my week is pretty busy. I would show you my schedule, but I'm like pretty much, I don't know, from like 9 to 5 or 6, I'm doing something every hour, right?
Okay,
So I don't
yeah,
have a lot of breaks,
of course.
because I see a lot of patients. I probably see about 25, sometimes 30 patients a week. So that would be like 5 or 6 people
Oh,
a day.
wow.
And then I'm also doing these other activities too. Like I'm
Mm-hmm.
supervising, and I'm meeting and doing, meeting with the clinic, and I'm like working on the Dr. Cat stuff. And there are usually some days like Mondays I kind of set aside for doing more the development of the app, and doing like supervision and things like that. So I'd say that because I'm seeing that many patients, like I am pretty, it's like some people have meetings all day. I have like
Mm-hmm.
patients back to back all day.
Got it, got
But
it.
I like that way. I like being
Mhm.
busy. It's
That's so cool.
fun.
You've mentioned a bunch of times how you love your job so much. I think that's so cool. So, just to kind of close off a little bit, you've given some amazing advice throughout this entire conversation, but I was just wondering, is there anything like super like that comes to your mind when you're trying to like for advice for someone that's like my age, in high school trying to figure out like what I might want to do, moving on and through college and beyond? Like, is there any advice you have for someone?
Yeah. Um, I think, I guess just, try different things. I mean, that I don't know, that sounds like kind of dumb, or
No, no.
but like, and don't be boxed in, right? Like,
Uh-huh.
again, in like I said, like in high school, I felt the weight of the expectations that were on me, and I really struggled initially with breaking free from what I felt like people wanted me to do, or what I felt like I should do. And like psychology also, I was like, what, psychology? We're like, what? It just I had to kind of like take a little bit of a leap of faith, and like I felt this pull towards it. Um and I'm just so glad I followed that, because otherwise I could be doing a career that again I felt like I should do, but wasn't as satisfying. That was such a pivotal moment in my life where
Mhm.
I could have just done what I felt like people expected me to do, because I was good at doing that stuff, right? I was good at the computer science. I could have just done that, but it I wasn't as passionate about it. So and I tell people, try things out. Like you also don't have to know exactly what you want to do, but like I'm like, try different things. Like, see, you might surprise yourself. Like one thing that you really think you're going to want to do, you're like, oh no, now that I try it, it doesn't fit. Like it doesn't fit me. This other thing fits me better. So just like don't lock yourself in, and um don't, right, like let other people's expectations drive future choice,
Yes,
basically.
that's
Hmm.
awesome.
Hmm.
Okay, well, thank you so much for
You're
having
welcome.
this conversation with me today. I I'm like learning so much, so
That's
it's
great.
so cool. I love it so much.
Yeah,
Uh,
great.
and thank you to all the listeners who are listening to this right now. I hope you learned as much from Dr. Ragan today as I did.